And we'll start off from the Labour front, exactly where my colleague Samuel Kojo-Brace left off on Top Story. And frustration and distress characterized the atmosphere in many government institutions as a strike by organised labour took a heavy toll on the operations of the Komfo-Anokye Teaching Hospital. Well, we know the courts, the ministries and many other government institutions were affected. Well, there was full compliance as the workers vowed not to work until they heard from their leadership. And of course, they heard from their leadership later in the day. Well, but even though the strike has been called off, there was pain and anguish for persons who had reported, especially to the Komfo-Anokye Teaching Hospital, as doctors and nurses were not attending to OPD cases. We'll start there, where my colleague Nana Boakye Dankwa-Yiadom monitored the situation before organised labour called off the action.
Here at the Komfo-Anokye Teaching Hospital, some of these patients who are seeking outpatient department services are stranded. They are left desperate. Many of them who traveled to seek these services would have to wait for some time. The nurses are taking their vitals, but then doctors are currently not here or not available to attend to these patients.
I came around 6 a.m.
At 6 a.m. this morning. Yeah. And what has been the situation? Have they attended to you or anything whatsoever?
The patients I came with, they've taken our vitals, but they are saying there's no doctor to attend to. So we are still waiting whether the doctors will come and attend to us. It shouldn't be like that. Normally by 9, the doctors should be around and be taking care of us. But since this morning around 8, we've not seen any doctor coming to take care of us. A certain patient was here, and it's so bad. The patient has to, she just fell unconscious and nobody was to attend to her so quickly. Then this has to rush her to the emergency ward. So we are pleading that they should please consider us, we the patients, and come and take care of us for us.
Many of these patients are here. They are stranded. They are desperate. They want the nurses or even the doctors to attend to them. Some of them are in critical condition. We would not be able to go beyond where we are right now. And
so
she's also a patient. She tells us that she came here earlier, but then the doctors are not around to attend to her. The nurses took her vitals, but then they've not referred her to a doctor yet. She's pleading with the doctors to call off the strike, and even TUC to call off the strike so that these doctors can come to work.
Okay, my mama me card. I said about 11 yeah about
my card. Say about 11 now.
About 11.
So no, say omon share. So he says that when he came earlier, he engaged with the nurses here. They took his vitals. They told him that he should wait for some time because his condition is very critical. He should wait for some time. They would attend to him. And that's the situation here at the Komfo-Anokye Teaching Hospital.
And now it's my colleague Nana Boakye Dankwa-Yiadom's interaction with some patients, those who patronize the Komfo-Anokye Teaching Hospital. And Joy News checks also at the court complex here in Accra reveal that workers did not show up at work today. Those who did left for home very early, leaving many people frustrated. Maxwell Agbagba monitored the strike at the courts. He also then went to the Kolebu Teaching Hospital plus the Mamprobi Polyclinic before it was called off. Here's his report.
The strike by the Judicial Service Association of Ghana has crippled business here at this court complex, as a lot of people who came here today for court hearings are going back home. Even the workers here are not staying back. We can hear from some of the frustrated people we've been speaking to here.
I've been here 2 hours ago, so we're supposed to have court this morning. So when we came, they told the court to not be sitting due to the strike. So we asked to go back here. So they didn't tell us when to come back. So it's a further notice.
So I didn't hear anything from my lawyer. That's why I came this morning. I didn't see nothing. Court is go on. I don't see anybody there.
I've also been speaking to a legal practitioner, Samuel Andrews, who is unhappy about the situation here. He has been speaking to some of his clients, urging them to come back to the courts tomorrow.
And if it continues, people would have lost a lot. There are people who are seeking injunctions, restraining others from doing something. On account of this, they cannot be held in court. Certain processes in court will have to be enforced on account of the strike. In fact, to put it bluntly, during this time we have practically a state of lawlessness. I had a hearing today. We now have to reschedule. My clients, for example, are asking me when the next court date would have been.
Here at the Kolebu Teaching Hospital, doctors and nurses are attending to some OPD patients. Sources tell me that because the Kolebu Teaching Hospital is a referral center, it is difficult to turn away people, especially who have come from very far places, to this facility. I've been speaking to the president and the chairman of the Health Services Workers Union here at the Kolebu Teaching Hospital, Caesar Bauer. Caesar Bauer tells me that his members, including mortuary attendants, are on strike.
Some like us at now, we are not working. So as at now, the orderlies, lift operators, admin managers, administrators, lab technologists, lab technician, X-ray technician, stores assistant, and mortuary attendant. I think we are more. So when you go around, you see that they are not working.
Here at the Mamprobi Polyclinic, doctors and nurses are not attending to OPD cases in compliance with the directive from organized labor. Some patients who are reported here earlier to this facility are frustrated.
That's Maxwell Agbagba's report from the Mamprobi Polyclinic, Kolebu Teaching Hospital, and of course, the court complex. Well, my colleague Kenneth Jesse also monitored the situation at the ministries. Listen.
Truly, they've kept to their words of not coming to work today. Today at the Education Ministry, few people inside. We have a cluster of ministries here. You have the Ministry of Education, you have the Ministry of Youth and Sports, the Ministry of the Interior. Over there also you have the Ministry of Rural Development. All of them are saying they are complying with the directive not to come to work. Earlier, we went to the Greater Accra Regional Hospital, popularly known as RICH, where the outpatient department is also on strike. We saw loads of patients there stranded, not knowing what to do, waiting on the nurses and doctors to turn up, but nobody was turning up. As I've mentioned earlier, we are at the Education Ministry. We have a lady here who is a concerned citizen who wants to share a few thoughts with us.
So obviously, as somebody who works in organized labor, I want the labor and the unions to fight for my rights and to make sure my rights are protected. And for that, there is no question. What concerns me, though, is that we are now mixing various things with different things that I am not quite sure of how things work here.
Well, that's my colleague Kenneth Jesse's report. Well, a huge sigh of relief can be sighed this evening, depending on where you stand, as normalcy returns to the country starting tomorrow. So that was the situation today in parts of the country that we visited following that labor strike. Well, we've been hearing from UTAG, amongst others. Well, they earlier had a position on the fact that the board and the Director General of SNIT should be made to resign. Well, Labour also held a press conference this afternoon, like I've been telling you, and of course they've called off the action tomorrow. All workers are expected to go back to work. The strike is off, but they have a 1 month timeline given to SNIT in terms of what should happen. Some changes they want to see. You've been hearing from Nale Adefio there on Top Story, mentioning that indeed the way workers retire, amongst others, should be looked at. And of course, Joy News will be bringing you a dialogue on this particular situation, the pensions situation. Will bring all stakeholders on board to be able to talk about what the way forward actually should be. We've been hearing also from the embattled Director General of the Social Security and National Insurance Trust, SNIT, Kofi Osafo-Marfo, and he's described as unfair the calls on him and his management to resign over their handling of processes to sell off some stake in 4 underperforming hotels. Listen.
The problem is we have pension fund assets. That is people's money. And again, I wouldn't say other people's money. It's people's money, workers' money. If you have a fiduciary duty to improve performance, would you not try to do something about it? Is that the real cardinal sin in looking to improve the performance of underperforming assets? I don't think that is wrong. And again, I think UTAG, it's universities. So let's talk about how one would manage a portfolio. You cannot manage a portfolio without doing anything. Something has to be done. We just have differences in opinion in how we arrive there. And that in itself is healthy because it means that we engage all stakeholders and we come to a solution. I don't think that it is ever possible that everyone would have the same solution in mind for a problem. Some people philosophically are even opposed to the simple fact that private investors are being brought in. You can never change their minds. Again, when we look at that and we look at the operational improvements that have been brought in, benefits processing times at about a third of what they are, the efficiency of the SNIT operations being much better, improve the portfolio because of that. The university teachers think that that is the wrong procedure. I think that is not fair enough.
Well, he tells my colleague Elton Brobe that he will engage all interested parties on the best way forward in terms of how or whether or not to sell off these hotels.
We are going to go back to the drawing board. The rationale at the time of lotting these hotels, and we lotted them with those in Accra, i.e. Labadi and La Palm being lot 1, lot 2 being the Cape Coast hotels, i.e. Elmina and Ridge Royal, and lot 3 being the hotels in the Western region. We've come to this point. We will go back and re-examine it. And again, as I said, this is an issue of stakeholder engagement. We've terminated the process. The stakeholders and ourselves will then sit down and we would see how we progress. I think that in the heat of things currently, it would be wrong for me to suggest openly my thoughts because that in itself could also go and raise other issues about, hey, he's thought of doing this again and he's doing this and he's doing that. No. Let's go back to the drawing board when we have a trauma environment, and then we will engage our stakeholders, arrive at a solution. I think what is important is that the status quo is not acceptable. The poor performance is not acceptable.
That's Director General of the Social Security and National Insurance Trust, SNIT, Kofi Osafo-Mafo. And if you do not know, you have to go to work tomorrow. Labour has called off that action.